Prince William arrives at the hospital to spend another morning at his wife's bedside. The palace is saying the Duchess of Cambridge is feeling better, but remains in the hospital with a crippling form of morning sickness. And we're focusing on this extreme form of morning sickness with our medical expert, Dr. Dianne McCallister, who is, of course, Chief Medical Officer at Centura's Porter Adventist Hospital. Thanks for being here, Dianne.
Oh, sure.
Now, morning sickness, not everybody gets it, but it's relatively common. So why is the Duchess in the hospital?
Most people who have morning sickness can treat it with home remedies and do just fine and it goes away. There's a group who have what's called hyperemesis gravidarum, which translated out of Latin means excessive vomiting in pregnancy. And these people are vomiting so much that they start getting dehydrated and they require IV fluids and some anti-nausea medicine in order to help them get stabilized.
What causes morning sickness?
Well, you know, the jury's out on that, but it's believed to be related to the high levels of hormones, estrogen, progesterone, and then beta-HCG that are part of pregnancy.
Okay.
Are some women more prone to getting this extreme form of it than others?
There are women more likely to get morning sickness and then extreme morning sickness. Those are women who've had vomiting previously in a pregnancy, women who are carrying multiples, so twins, triplets, or more, and then, interestingly, people who have had vomiting in the past from migraines or motion sickness, or even from smells or tastes, are more likely to get morning sickness and then extreme morning sickness.
In addition to just being unpleasant, can it be dangerous at times?
Well, you know, for most people it is not dangerous and they can take care of themselves at home. But for some women who start losing nutrition and losing weight, or who are getting dehydrated, or you can, from the excessive vomiting, you can actually make a tear in your esophagus, which is the tube between your stomach and your throat, and get some bleeding. So those are reasons where it does get dangerous.
Okay. Well, it sounds miserable. Is there anything you can do to prevent it?
You know, there's a lot of home remedies. A lot of people find that drinking ginger ale or lemon lime soda will help. A lot of women will tell you that eating a little bit all day long, they'll carry soda crackers with them. And then avoiding things that trigger the nausea. Certain smells during pregnancy can set people off. For some women, that doesn't work, and then again, we have to use a B6 vitamin supplement or anti-nausea medicine, but really you need to talk to your physician because there's some underlying medical problems that need to be ruled out as well.
So is it possible to have morning sickness with one child but maybe not the next one? Or once you get it, you're kind of always prone to it?
It is possible. I've had patients who had it with one and not with the other, but you're more likely to have, once you've had it, you're more likely to have it again.
All right. Well, thank you, Dr. McCallister, for shedding some light on this for us. And you can find all the doctor's advice on thedenverchannel.com. Just look for the Lifestyle tab and click on Staying Healthy.